Today's webinar is on ending veterans' homelessness, and we are looking forward to sharing some insights and learnings with you from our Built for Zero communities today. I hope that everyone had a reflective Remembrance Day yesterday and were able to honor our Canadian veterans in your own way. My name is Amanda DeFalco, and I'm the Veteran Strategy Lead and a Built for Zero Improvement Advisor with the Canadian Alliance to End Homelessness. Just a couple of logistical items. If you are not on mute, I will ask you to please put yourself on mute so that we can avoid any feedback. The mute button can be found along the taskbar, the Zoom taskbar towards the bottom of your screen. We also invite you to share video if you'd like. And you can use the chat function. Some of you have already been doing that by letting us know where you're from. This is the mechanism by which you can also send us in your thoughts, feedback throughout the presentation, and ask any questions as well. We will have time at the end of the presentation to answer any of those questions. And Marie Morrison is joining me today, who will be moderating that chat function as we go through the presentation. So thanks in advance, Marie, for that. For those of you who are new to Canadian Alliance, you might not be, but if you are, welcome. Wanting to let you know that we are an organization whose mission it is to lead a national movement where we work alongside individuals, organizations, and local communities from coast to coast to end homelessness in Canada. There are several ways that we work to end homelessness at the CAH. Each initiative is designed to improve outcomes for the people experiencing homelessness, while remaining steadfast and connected throughout our ultimate mission, which is ending all homelessness in Canada. I'd like to start by passing it over to President and CEO of the Canadian Alliance to End Homelessness, Tim Richter, who's going to say a few words for us. Over to you, Tim.
Thanks, Amanda. Hi, everybody. Thanks for joining us. I think this is a really important and I think exciting webinar for us to be talking about a topic that is desperately in need of our attention. I want to start by acknowledging the veterans on the line. I want to thank you for joining us. I want to thank you for your service and for veterans and family members of veterans. I also want to acknowledge the veterans organizations, so the Royal Canadian Legion, Vets Canada, Military Family Resource Center, Soldiers Helping Soldiers, and others that may be joining us or have been working in this space for a very long time. You know, we talk about how bad veteran homelessness is in Canada, but I think it would have been much worse had these organizations not been there. I also want to thank and acknowledge Veterans Affairs Canada. Veterans Affairs Canada is supporting the work of Built for Zero on ending veteran homelessness through the Veterans and Families Wellbeing Fund. So thank you to VAC. I think I'll be super quick in just to say, you know, we just had Remembrance Day. We've had a Remembrance Day where, again, another Remembrance Day has passed where we have thousands of veterans, somewhere up between 6,000 and 8,000 veterans potentially on the streets of or in the shelters of cities in Canada. To me, you know, and I've been kicking around the military and the veterans community for years, but to me, remembrance, it's one thing for us to, and I think it's important that we acknowledge and we remember veterans and remember the sacrifices that veterans have made to Canada over the years. But to me, remembrance has to be a verb, right? It's not a passive act where we, you know, put on a poppy and we go to a ceremony and we'll do it again one more time next year. We know that there's thousands of veterans on the streets of our country. We know that there's veterans food banks, and so there's a lot that we can do. And we have, in my view, a duty of care to veterans that is unique and specific to their service. So we have an obligation as a community and as a country to do what we can to end veteran homelessness as rapidly as possible. I think rapid success is possible. We're going to hear from some communities that are doing some really phenomenal work and moving the needle fairly quickly. And I think there's some real keys to success. And I think that a big one is just making sure that getting the veterans community together and veteran service organizations together with the homeless and housing organizations. And when that partnership is possible, a lot of success can happen really quickly. And for the Alliance, you know, our role in ending veteran homelessness is really, you know, in that support and coaching role. We know that veterans organizations have been leading this work forever. We know the communities have been responding to homelessness forever. We're a bit like Home Depot and their old motto, "You can do it, we can help," and we're happy to do that. I think I'll wrap by saying, you know, the work you're doing is really important on ending veteran homelessness. It's vital, not just because we have a duty of care to these veterans, but I think it's also important to remember that ending veteran homelessness is and will be, I think, a gateway to ending all homelessness. Allows us to test the strategies that are effective in ending homelessness. It allows us to put in place some of the key practices that, like finding list, coordinated access, housing first, things that are proven effective in ending veteran and all homelessness, and allows us to get some success which builds on that we can build on in communities, and it puts in place the infrastructure that communities need to end all forms of homelessness. I think we last June, there was, and I know there's a couple of folks online for the Legion, maybe from Vets Canada, we were successful, the Royal We, in getting a federal or an all-party motion with unanimous consent in the House of Commons, pushing the federal government to end veteran homelessness by 2025. That the implementation or the action on that commitment hasn't come yet. We're continuing to push them, and I'm hopeful that something will come in the next 6 months. So you're really on the cutting edge of what I hope will be the beginning of the end of veteran homelessness and a rapid end of veteran homelessness on the way to ending all homelessness in Canada. So I just want to thank you for joining us. Thank you for your work. And as always, if there's anything we can do, don't hesitate to reach out to us. Thanks, Amanda.
Thanks, Tim. So Tim alluded to a few things already about what to expect on the call today. But again, I just want to reinforce that helping veterans experiencing homelessness is not new. For many years, we recognize that veteran organizations have been actively supporting veterans experiencing homelessness in Canada in local communities all across the country. I believe that these efforts have significantly helped alleviate pressures in local communities' housing and homelessness response systems, because without that help, we would be much worse off, as Tim had said. The housing and homelessness sector is changing across Canada. In just a few short years, the federal government, provinces, and local communities have shifted from managing homelessness to ending it. Today, there's new hope arising from communities who are demonstrating that reducing and ending homelessness is in fact possible, even in the midst of a pandemic. And you're going to hear a little bit more from them later on today, or later on throughout the presentation. Tim also shared with you some of where we've been, and so I won't go back all the way in time, but let's start with June of 2018 and really wanting to talk about the Roundtable on Homelessness, where a series of recommendations were developed. The Veteran Affairs Canada continues to action recommendations today on those. In May of 2019, a Veterans Advisory Standing Committee, the House of Commons, released a series of recommendations called Moving Towards Ending Homelessness Among Veterans. And then in June 2019, a motion was brought forward to end veterans homelessness in Canada by 2025. And as Tim said, we continue to push that agenda to have the federal government make that commitment. From August to December of 2019, the Canadian Alliance to End Homelessness entered this space to really help support the effort of ending veterans homelessness in a formal way, where we now receive funding from the federal government through both Veteran Affairs Canada, as Tim mentioned, and also through ESDC, the Reaching Home program, which is the federal homelessness funding program as well, to support communities in their efforts to end homelessness. In January of 2020, 8 communities across the country signed on to participate in a pilot using a similar methodology used by US communities that have ended homelessness through their Built for Zero initiative. Tools, resources, and techniques were adapted to a Canadian context and tested throughout the pilot. And the information we're highlighting today is based on those learnings from both the pilot and ongoing developments with what is now 12 communities in our campaign, or movement, I should say, that are working towards ending chronic and veterans homelessness. So the Built for Zero movement is an ambitious change effort nationally to help a core group of leading communities end chronic and veterans homelessness, which is the first step to eliminating all forms of homelessness in Canada. Great programs and services for people experiencing homelessness alone aren't enough to end homelessness. That's sort of the old way of thinking. Getting to zero takes a whole system built to drive reductions. If you can imagine, for example, if our doctors, hospitals, medical specialists, and labs didn't coordinate our healthcare, if they didn't share our data or coordinate a treatment plan, that's essentially how we've been working to serve people experiencing homelessness. But as mentioned, that is changing. And that's where Built for Zero really comes in. It's a movement using evidence-informed methods and building proof points in local communities across the country working to end chronic and veteran homelessness and proving it's possible. The Built for Zero approach started in the US, where 11 communities have now ended veterans homelessness. And the Canadian Alliance to End Homelessness took that model and adapted it to a Canadian context, as I mentioned. There are currently 33 communities who are participating in the Built for Zero initiative across the country. And these communities adopt a structured, data-driven approach focused on optimizing local homeless systems so that homelessness is rare, brief, and non-reoccurring. These communities are recognized as leading the way to ending homelessness in this country. And as mentioned, 12 of those communities are now working specifically to reduce and end veterans homelessness in Canada. In January 2020, 8 communities joined us to test out our methods and practices, and 4 additional communities joined us in July of 2020. So we're going to highlight today those lessons learned from the pilot and how those lessons are shaping the way that local communities are moving towards and responding to reducing and ending veterans homelessness. I'd like to recognize and acknowledge those who took a leap of faith with us back in January. So Fort McMurray, Kingston, Peel, Hamilton, Chatham-Kent, London, Moncton, and St. John's. And I also want to take a moment to recognize and thank these local communities for really leaning into that learning and understanding what it would take to help reduce and end veterans homelessness. I also want to thank and welcome our 4 additional new communities who are coming on board with us. So Kelowna, St. John, Windsor, Essex, Sault Ste. Marie, and Ottawa. They're working to standardize practices, build deeper connections with veteran organizations, and again, really leaning into that data. The reason we work with local communities is because they're delegated by federal and provincial governments as lead organizations for local housing and homelessness serving systems. These leads, often but not always local governments, are funded by federal and provincial governments to administer and coordinate local homeless system responses. They also have oversight to implementing evidence-informed practices and measuring local efforts to ensure that they're meeting funding targets and expected outcomes around reducing and ending homelessness. In addition to oversight over the homelessness response system, many also oversee housing resources such as social housing and other housing subsidies as well. So when the veteran community cohort pilot began, we asked communities who were joining us to commit to a few different things. One of them being that they would aim to functionally end veterans homelessness, and we'll talk a little bit about what that meant. Adopting standardized terms and definitions, achieving a veteran quality by name list, which is a data mechanism tool that we use to measure and understand individual needs and preferences, but also understand and make improvements to the system to lead to improved results and reductions. We asked those communities to collect and submit monthly real-time data on veterans. Coordinate efforts with local veteran organizations and take on improvement projects to functionally end veterans homelessness. Our goal by the end of the pilot phase was to have 2 communities achieve a quality veteran by name list, and we achieved this. So both London and Fort McMurray were successful in getting their real-time data system up and running to include information on veteran homelessness in their communities. And since then, 2 other communities, St. John and Moncton, have achieved a quality by name list for veterans as well in just a short few months. Today, we'll highlight 5 key lessons learned throughout the pilot, which include a focusing on deepening awareness and knowledge between veteran organizations in the housing and homelessness sectors, coordinating responses through those partnerships, the value of using real-time veteran data, and leveraging all available resources, both through the veteran organizations and through the housing and homelessness sector. Built for Zero Canada recognizes the importance and value of veterans' connection to the military and veteran community. In many cases, veterans experiencing homelessness are more successful in their housing when they're surrounded and supported by other veterans who share their military experiences. Veteran organizations have been providing financial and peer support to veterans experiencing homelessness for many years, as I've mentioned. And a critical aspect of the Built for Zero pilot was developing these relationships with veteran organizations, both nationally and locally as well. A critical aspect of the Built for Zero pilot also included specific working relationships with certain veteran organizations, but I want to note that this is not an extensive list of all veteran organizations serving veterans experiencing homelessness across the country. These organizations in particular have worked alongside us throughout the pilot, and we look forward to building further relationships with other veteran organizations along the way as we continue this work as well. I want to start by sharing the first lesson learned through the pilot, which is really centered around partnerships. So most local housing and homelessness lead organizations have been doing this work for quite some time. It's not to say that they weren't serving veterans, but they just didn't quite know who those veterans were in their system. So not always being aware of who those veterans are means that we're not taking full advantage of providing veterans with access to a full range of services and supports that they could be eligible to receive. Local communities used the VAC interactive map and reached out to their local Royal Canadian Legions to start developing a better understanding of who was serving veterans experiencing homelessness in their local community. They also reached out to local VAC field offices as well. And we learned a lot about what's working and what could be improved upon to help coordinate and improve services for veterans experiencing homelessness to help end their homelessness faster and more efficiently. I have to say I worked for 11 years as the manager leading the homelessness response system in Hamilton. And before coming on to this work, I didn't fully appreciate or understand the full range of services and benefits for veterans as well. It's not to say that veterans organizations aren't out there working with programs and veterans experiencing homelessness. It's just occurring at an operational level or at a program level rather than coordinating it at a systems level. And so what that means is that if we're not looking at it from a systems perspective, veterans accessing services and programs across the system may not be identified, or they may not be gaining access to those benefits and services. We can use the healthcare analogy again. It's like working with patients from one doctor's office to treat cancer for the whole city. And so what we're trying to do is ensure that veteran organizations are well connected into the homelessness response system at the sector level as opposed to just at a program level. Local homeless response systems are now inviting veteran organizations into the space where decisions and coordinated efforts across the entire system are being made. And throughout the pilot, local community leads have been reaching out to several veteran organizations to promote coordination. At a national level, Built for Zero Canada works with partners to highlight these opportunities and remove barriers so that the coordination efforts can be facilitated and streamlined at a local level. I'd like to start by inviting Peel Region to share their work underway with respect to their partnerships.
Hey everyone, sorry, I'm just going to turn my video. Oh my God, sorry, I'm going to turn my video off. I've got a Zoom background from another seminar that I was doing the other day. So Hi, everyone. Let's start that again. My name is Daphne Nussbaum. I am the program coordinator and analyst for the Peel Alliance to End Homelessness. I am honored to be part of this panel. I think this is very important work, especially as we commemorated Remembrance Day yesterday, and really glad to be supported by the Canadian Alliance to End Homelessness on this work. So in terms of the way that we have been working on developing our veterans by name list in the region of Peel, to sort of figure out a way to connect with organizations in the area. So our initial outreach was sort of focused on the community legions. The difficulty was that some of them weren't open, so there were a few non-responses due to closures because of COVID. We also reached out to the Royal Ontario Legion and met with Dave Gordon, who I believe is on this call. Hi, Dave. He's the committee chairman for Operation Leave the Streets Behind, which is the Legion's National Homeless Veterans Program. That started out of the Ontario Command. The program's mission is to reach out to homeless veterans and those at risk of homelessness and provide them with immediate financial assistance and support. It also connects them with the social and community services to establish a long-term solution to meet their needs. So yes, we connected with Dave and invited him to join our senior leadership table. And that was back in the summer, and he presented Operation Leave the Streets Behind at one of our meetings. Since then, the Royal Ontario Legion, or Dave, has joined our coordinated access team as we are in the midst of developing our model for the region appeal, and input from the Royal Ontario Legion and any other veteran services is crucial for the work that we're doing. And yeah, so we feel that having these partnerships will inevitably help us reduce and end homelessness in our region. And we are also working with one of our community partners, the Salvation Army, to serve as the lead access point for all veterans experiencing homelessness in Peel region. So the Salvation Army would work with us to confirm veteran status, and then hopefully add names to our veteran by name list. So this is a work in progress, but we feel like we've made some strides, and we'll just continue. And that is it for me. Thank you.
Thanks so much, Daphne. I think one of the interesting things is that by having a lead organization in communities working to identify and confirm veteran status helps to streamline the process a little bit further and helps the veteran organizations engage, because they don't have to work with several different access points. They're really focusing on one centralized way to get veterans added to the by name list, referred to the by name list, and ensuring that veterans are accessing that by name list, because the by name list is the mechanism that communities are using to tailor coordinated housing plans and responses for people experiencing homelessness, including veterans. Thanks for that. The next key focus area for learning is really around streamlined practices, as we just alluded to. And so one of the key aspects of the pilot was to create standardization and consistency across homelessness response systems in Canada, in those 12 communities that we're currently working with, and hope to continue to do that work across the country. So this includes identifying veterans, confirming their status, and coordinating a streamlined response to locally maximize resources that are available. During the pilot, a standard definition of veterans was tested, and we'll talk a little bit about what that, where we landed on that, and also having a centralized point for services was a big learning as well. And so confirming veteran status has been a bit of a pain point for the homelessness response system, but communities have really leaned into understanding the veteran system and have now mechanisms for confirming veteran status, so that when that status is confirmed, veterans can get connected to services and supports that are veteran specific. So we first started our definition at the beginning of the pilot, which was limited to former members of the Canadian Armed Forces and reservists. But through consultation, feedback from the pilot, veterans organizations, and listening to veterans with lived experience, our definition of veterans was expanded and updated. So today, when we say veteran in our homelessness response system, we're talking about members of the Canadian Armed Forces and reservists, and also former members of allied forces, former members of the RCMP, veteran civilians, and former Canadian Rangers. The main reason was based on the opportunity through the identification for veterans experiencing homelessness to access benefits and services, primarily through Veteran Affairs Canada, but also other veteran organizations as well. Our definition, which is up on the screen here, was based on the Veteran Affairs Canada definition of a veteran, with one exception, which is that we don't look at honorable discharge. So veterans that were not honorably discharged are still identified as a veteran in our system. And we married that definition with the Canadian definition of homelessness, which is used by the federal government. And that definition was based on a research project through the Canadian Observatory on Homelessness, and was adapted for the federal Reaching Home program, again, which is the program for homelessness funding across Canada. We also use another definition, which is called functional zero. So when we refer to ending homelessness, we mean that a community has reached functional zero. Functional zero is a standard definition and an accountability measure that indicates that a community has solved homelessness for a specific population. Ending homelessness does not mean that no one will ever experience homelessness again in that community, but rather that the systems are in place to ensure that any experience of homelessness is rare, brief, and non-reoccurring, and that people's homelessness is permanently resolved and recidivism isn't occurring back into the system. So once people are housed, they're not coming back into the homelessness response system again, if we can prevent it. Again, going back to the healthcare analogy, the health system won't necessarily prevent all people from getting sick, but it will ensure that when someone does fall ill, that a triage takes place and that they receive appropriate treatment so that the illness doesn't become a crisis. So that's essentially what the homelessness response system does as well, from the perspective of housing and homelessness. Throughout the pilot, we examined what it means for a community to end veteran homelessness. Our standard definition was tested using the US definition of functional zero for veterans, which is that when a community has fewer veterans experiencing homelessness that it can house in a month, or has less than 3 veterans actively experiencing homelessness in their system, they have reached functional zero. There's also a confirmation process that's in development stages that we'll be using to ensure that the system can sustain this response effort beyond simply meeting this definition, while working towards absolute zero, which is always the ultimate goal. Another key learning from the pilot is that veterans are not a homogeneous group of people. While affiliation as a veteran is important to a person's identity and access to additional benefits and supports, veterans experiencing homelessness and the response to veterans experiencing homelessness is not uniform. Intersectionality with other aspects of a person's identity that significantly impacts a person's experience of homelessness needs to also be considered, such as gender, race, indigeneity, disability, and age, to name a few. The homeless response system can enhance supports for veterans as part of building a coordinated local response, which means building an equity, inclusion, and trauma-informed practices into service delivery. A number of housing and homelessness resources are also designed and tailored to serve specific population groups. Since we can't be all things to all people at all times, designing a customized response based on a person's needs and preferences can be done by pulling in the right mix of services and supports. This is ultimately the reason why working together is leading to rapid progress. I'd like to invite Fort McMurray to share a little about their community approach and how they work to identify and confirm veteran status in their community. I also want to add, before they jump in, that Fort McMurray has reduced chronic homelessness by 49% and are turning their attention towards ending veterans homelessness in the coming months. So thanks, Fort McMurray, over to you.
Nicole is, I don't know, I think we might have lost Nicole.
Can you hear me now?
Yeah, we can hear you now.
Okay, sorry, I was talking away and no one could hear me. Okay, I'll start again. Sorry about that. Thank you, Amanda. My name is Nicole Hinks with the Regional Municipality of Wood Buffalo, working as a social program advisor with the Community Plan and Homelessness team. On the line, we also have Teresa St. Pierre, who is our centralized intake worker with the Wood Buffalo Wellness Society. She is going to be, she's going to discuss some examples later on after I'm done my section. So thank you all for taking your time to listen to this webinar. We're really grateful to have you here and we're excited to share our work with you. The process that we follow as a community when a new participant is seeking housing support is first that all participants that complete an intake for housing are asked a veteran standardized question. If a participant identifies as a veteran, the centralized intake team worker will then ask if they have a veteran's identification number. If the participant has a veteran's identification number, the centralized intake team will call and connect the participant with the Legion. If the participant states that they are a veteran but do not have their card or number on hand, the centralized intake worker will connect with Veterans Affairs Canada to support with confirming veteran status. And once the status is confirmed, they will connect the participant with the Legion. At times, a participant can be transferred into a housing program, and the centralized intake worker will collaborate with the case management team to ensure that status is confirmed. Our binding list veterans identification. Once we began focusing more efforts on ending veteran homelessness, we looked at our current binding list and ensured all participants were asked the standardized veterans question. And we asked our access points to ask the question again, just to make sure no one was being missed. And now Teresa will take it over and share some current examples of how our centralized intake team coordinates with participants to see if they are a veteran and if they are eligible for assistance.
Good morning. My name is Teresa St. Pierre and I'm a centralized intake worker. And I have only had actually 3 individuals identify as veterans. And I will just discuss 2 of the cases that of individuals who are veterans. One gentleman said he served for 3 years in the Canadian Forces. And so I connected, he was transferred to a housing coordinator. And I contacted the local Legion at that time. And he didn't have a number or couldn't remember his number. And he was eventually assisted by the Veterans Affairs for his rent for a couple of months and his utilities for a couple of months. And the local Legion provided food vouchers for him from the Poppy Fund. And one other individual that we're currently working with, he was transferred to a housing coordinator as well. He said that he he completed basic training, but then he discovered he was going to be a father, so he decided not to continue in the forces. And he doesn't have a number or doesn't recall his number if he does have one. And so we have contacted Veterans Affairs on his behalf to see if he does qualify for any benefits. And at the moment, we're currently waiting for a response. So we do everything that we can to help any individual who says that they are a veteran or have had any interaction with the Canadian Forces. That's it for me.
Great, thanks so much, Nicole and Teresa, for sharing how Fort McMurray is working to identify veterans and get them connected to services and supports. One of the important lessons there is also making sure that we have a standardized question so that frontline staff and workers know how to ask the question so that veterans can identify. And once they do identify, the important piece there is really making sure that we're able to confirm veteran status and get them connected to veterans organizations for support. So you can't improve what you can't measure. While there are estimates of homelessness in Canada, including veterans homelessness, our goal was to design a response system, local response system that is evidence informed and driven by real-time data. Local communities in the BFZ Canada campaign, movement, they collect data using a specific data collection method which includes key data points to understand data not only at an individual level, but also at a systems level as well. For example, local communities know how many newly identified veterans there are coming into the sector, how many moved into permanent housing, and how many are returning back into homelessness from housing. And those are just a few of the indicators. There are more as well. It begs repeating that this is looking at data from across the entire sector and not just one or two programs, which really allows us to have a deeper and better understanding of homelessness, and specifically in this case, veterans homelessness in local communities. Throughout the pilot, specific veteran data indicators were built into the local data systems so communities can assess in real time and respond accordingly to improve outcomes. Sometimes this means early identification gets veterans connected to peer supports faster. They can start the process to accessing Veteran Affairs Canada benefits sooner. And ultimately, all those efforts are for the purpose of helping to accelerate the process by which people get housed and get them connected to supports to keep them housed. I'd like to welcome St. John to join in and share some highlights about what's happening in their community. And just want to let you know that St. John is right on the cusp of a reduction as well. They are just about to be announced for reducing 10% of their chronic homeless population. And I know that they're leveraging what has led to that success with their veteran cohort as well. So welcome, Michael from St. John.
Thanks, Amanda. So my name is Michael McKenzie. I work for the Human Development Council here in St. John, which is the community entity under Reaching Home for St. John, Fredericton, and Moncton. And as the CE, we support the implementation of coordinated access in each of those communities. As Amanda mentioned earlier, St. John is one of the more recent additions to the veteran cohort of Built for Zero. We started submitting data this past summer, but veteran homelessness is something that we've definitely been talking about for several years at this point in St. John. We started to really intentionally engage Veterans Affairs back in the fall of 2018. And part of that engagement was around the language that we were using to ask about veteran status on intake. The overall numbers of veteran homelessness that we were seeing were typically quite low. And so there was a question as to whether we might just be undercounting. And so part of really starting to improve our data, as Amanda was saying, was to standardize that question. And so that was initially part of our engagement with Veterans Affairs. The second part of that engagement was to invite VAC to an event that we were holding to demonstrate the effectiveness of coordinated access, which again is essentially streamlining the process to access housing and supports for folks who are experiencing homelessness. So we invited VAC along with social development, New Brunswick Social Development, our regional health authority, the city, corrections, both provincial and federal, and a number of frontline agencies. And we did an experiential learning exercise. So we actually had all the attendees walk through essentially the journey of someone experiencing homelessness and trying to navigate a homeless serving system that did not work as a system. So if you are a veteran experiencing homelessness, you would have to find your way to VAC to access the supports that they have available. You're also going to have to navigate your way through provincial systems to get set up with income assistance, likely a separate system to get on the waiting list for affordable housing, and a separate system if you need to get identification. And this is all before you actually get to the housing piece. So with coordinated access, the idea is to streamline that whole process and reduce the need for a veteran or anyone else experiencing homelessness to navigate that whole system on their own. So for us, from that perspective, having veteran serving agencies involved from the start was a no-brainer. Immediately following that event, we implemented a pilot coordinated access system. And so VAC was there from the very beginning. We met with them to discuss what resources actually were available for veterans experiencing homelessness. and to confirm that they could be accessed by folks who were on our by name list. And then more recently, we started going through that process with the Legion as well. Even before becoming a member of the veteran cohort of Built for Zero, our community had agreed to make veteran status a priority, one of our prioritization factors. So essentially anyone who identifies as a veteran on our by name list would receive a point or be bumped up in a ranking on our priority list for housing. Our local Veterans Affairs office does complete BNL intakes. So when a case manager is working with someone who is experiencing homelessness, they can access our BNL intake form online and complete the intake and have the client prioritize for housing. And then based on an assessment and determining the client's acuity level, we would then determine whether they need more intensive wraparound supports that would be offered through a program like Housing First, or if they have an acuity level that they would be okay being supported by their VAC case managers. And more often than not, it's actually a combination that we would connect the Housing First team or Rapid Rehousing team with Veterans Affairs to kind of double up on those supports. VAC also confirms veteran status for clients on our BNL, whether or not they've completed the intake for that client. And as Nicole was describing the process in Fort McMurray, it would be very similar here, whereby our BNL coordinator would be connecting directly with VAC to confirm the status. In reality, especially in a community the size of St. John, we have roughly 70,000 people. We're not talking large numbers of homeless veterans. So I think right now we have a total of 7 veterans, but that includes those who are actively experiencing homelessness or who have gone inactive. And it also includes one who is currently housed. So when you have agencies like the Legion and VAC who have dedicated resources for this particular population, and when we're coordinating with New Brunswick Social Development, as well as other support agencies and housing programs, we do think that we can achieve a significant reduction fairly quickly. One thing that we would identify would really help those in driving down those reductions would be rent supplements or housing vouchers, specifically dedicated for veterans, so that we could continue the work of driving overall reductions for chronic homelessness, working with the limited number of rent subs that we have available through our province, while also working to achieve functional zero and eliminate veteran homelessness. So I think that's all I have. I don't know if that covers any of what you wanted me to cover, Amanda.
That was great. Thanks, Michael. Yeah, that was a great example of the work underway in St. John with veteran organizations and really leaning into some of that data. So thanks again for sharing. One of the things that Michael also shared that I'll just maybe highlight and expand upon is really understanding how to ask the question of veterans if they are in fact a veteran. So that standardized question is now universal across the country in all the homelessness serving systems that we're working with. There's a specific way to ask that question, and we've, again, that question was developed in consultation with and through feedback from veteran organizations, as well as veterans who are with lived or living experience as well. So that was really helpful. The one other point that I'll just make there was the importance of housing subsidies or housing allowances. A veteran is not considered housed until they have access to permanent housing. And so communities that are measuring a reduction in veterans' homelessness, those veterans need to be housed in a permanent housing situation. Doesn't mean that they have to live there forever. It just means that they have to have a right to that housing through a lease or other forms. And when they do, we can oftentimes provide housing subsidies or housing benefits. And those benefits oftentimes come from federal and provincial governments, but in some cases, municipalities also provide housing subsidies or housing allowances as well. But again, that housing has to be considered permanent in order to access that. And that really does help make rent and housing ultimately more affordable for folks. Some communities like Ottawa and London have designated veteran homelessness advisory groups and committees where both veterans and homeless sectors come together to plan, coordinate, and respond to veterans experiencing homelessness in communities. And so you've heard already from a few communities how that's underway elsewhere as well. This is really where the magic happens. When you have person-specific data to coordinate a tailored housing plan, mobilize those supports, access income benefits for veterans, can really help those veterans get housed and stay housed. When you're measuring and tracking effectiveness and efficiency of those responses by looking at the whole picture through a systems lens, you can target areas for improvement and then rapidly test and evaluate changes to your system that lead to better outcomes for the people experiencing homelessness that are veterans in communities. If and when tests of change are working, communities will scale up and enhance that improvement. And if they don't, it's a fail forward moment for those communities where they go back and try something new until they get the best possible results for veterans experiencing homelessness. This sometimes means access to a wider range of services and supports to help gain a broader range of housing options through the housing market. It also means helping to end a person's experience of homelessness faster so that they don't have to lag in the system for any longer than necessary. Built for Zero Canada continues to support capacity building and training across sectors and encourages ongoing coordination efforts using evidence-informed practices and, again, real-time data. When a community is able to identify veterans, confirm veteran status, connect them to veteran supports and benefits, and ultimately leverage the resources available in the housing response system, we can end homelessness faster. Increased access to income supports opens up the housing market, as mentioned. Understanding their individual needs means that the homeless sector can customize the level and type of housing supports to help veterans move in, and once housed, can help them get them stabilized in that housing so they don't become homeless again. Built for Zero Canada continues to design, tailor, and update tools and resources for local Built for Zero communities to assist in their efforts to get veterans housed and help keep them housed. And Built for Zero communities also receive support on their data collection through system improvement efforts and also resources that we have available on our website that I'll share with you in just a moment. And also those local communities receive coaching as well. So one of our communities has been focused on these efforts before Built for Zero, but certainly have honed in and really enhanced those efforts over the last few months. They were the first in Canada to achieve a quality by name list of all known veterans experiencing homelessness in their community. They've leveraged their expertise of veteran organizations locally by coordinating individual housing plans using real-time data. They match veterans and housing resources and constantly are making improvements to their system based on their real-time data. As a result, they've reduced veterans' homelessness by over 75% in just a few short months, and that was during the pandemic as well. I'd like to welcome London, Ontario, and congratulate them on their efforts that are still well underway. And we are confident that you are going to lead the way on reducing and ending veterans' homelessness in Canada. I invite you to come on and share your learnings and highlight the key actions that you've been taking that have been leading to rapid success. Zane, over to you.
Thanks so much for that lovely introduction, Amanda. Hi, everyone. I'm Zane Easterbrook. I have a background in trying to solve veterans homelessness in London that dates back to about 2012. I would like to echo some of Tim's sentiments earlier and just say a big thank you to any and all veterans on the call, those who have family members who are actively serving or participating in military training. I'd also just like to say a big thanks to CAH for coordinating these events and for your ongoing leadership in advocating to levels of government to prioritize solving veterans homelessness and for coordinating some best practices across communities in Canada. So thanks to you. I'll take us on a little travelogue from 2011, going all the way back nearly a decade now, to where we are today. And hopefully that will hit on all of the different points that Amanda has asked me to touch London has a rich background of prioritizing veterans homelessness in our community, and it stems back to our involvement in a pilot project called the it was the Canadian Model for Housing Support for Veterans. It was a 4-site pilot project across Canada, so it included Toronto, Calgary, Victoria, and London. Each site used a sort of different model to try to address and end veterans homelessness that was unique to their community based on what resources they had at the time. London at that time was launching into more of a housing first approach. So the structure we used was a mixed scattered site, intensive case management model. As with all sort of nationally funded pilot projects, it came with some money, and so it was easy to get a few extra players to the table and to create a truly collaborative model to addressing veterans homelessness in London. It was also easy for us to tap into some of the amazing work that was already happening at the Royal Canadian Legion to support veterans experiencing homelessness. So from that pilot project, the Veterans Experiencing Homelessness Advisory Committee was formed, which was a service collaborative between the City of London's homeless prevention system, a lead agency that was the Housing First program, London Cares, who provided one full-time intensive case manager dedicated just to supporting veterans, as well as a peer engagement worker, a local emergency shelter, Unity Project, who really championed identifying veterans in our emergency shelter system to refer into the project. London Police were involved, the Royal Canadian Legion, who I mentioned, the Department of National Defence and their OSIS program was instrumental in that pilot project. Veterans Affairs Canada, Parkwood played a key role in their OSIC clinic. So then that might be something that is fairly unique to London. And lastly, Lawson Research helped to oversee the research and evaluation component of it. So from that, we saw tremendous success. We learned from other communities through regular contact with them, and it was, some calls celebrating successes and sharing what was working, and commiserating about things that were kind of going to shit, and moving forward. And the end result was that housing first interventions work with veterans experiencing homelessness. So a best practice manual came out of that. In addition, some of the lessons learned were that collaboration is absolutely essential across sectors, that without veteran serving organizations being at the table and the cross-pollination of the experiences and knowledge of the homeless serving sector, that we just wouldn't have seen those successes. A harm reduction approach was really key, and last but not least, London found that the involvement of OSIS and a peer support worker were essential. A lot of the veterans who participated in that pilot project said, without that, they wouldn't have been as motivated to continue to strive for housing stability. So that was a big part of the secret sauce for the success we saw. So that program received permanent funding and is still ongoing, and everyone sort of patted themselves on the back. And from that, the Veterans Experiencing Homelessness Advisory Committee continued on, shifted its focus to motivating, educating, and inspiring a systems and integrated approach to solving veterans homelessness locally, launched into regular lunch and learns where people could network across these different sectors, and we could sort of move both of those sectors forward on developing core competencies. Another year or so went by, and we realized, oh shoot, our data might not actually accurately reflect that we are being as successful as we think we're being. So enter Quality by Name list and HIFIS. and some circling back to some of those points of access where we had done a lot of outreach to say, are you asking everyone if they've served? And linking back in through to our homeless serving and veteran serving programs to make sure that HIFIS captures those individuals and that we know everyone by name. And having done that and improved our data quality, I guess the next step for us was really to come together as a homeless serving sector, a veteran serving sector, and to name and prioritize veterans experiencing homelessness as a population who needs to be on our community's priority list. So having done that, there were a number of veterans who were newly identified, but then there was also community commitment and consistency in how we matched individual veterans to the most appropriate programs through our coordinated access system. And that sort of brings us to date on a lot of the successes that we've seen here, Amanda. I don't know if there's anything else that you were hoping that I'd comment on.
Well, I think that's wonderful. One of the things, Zane, that I've noticed about London is just how committed you all are to using your data to really hone in on individualized housing plans for veterans and really looking at your data almost every day to make decisions around how best to respond to those veterans in your system.
Yeah, having real-time data has been instrumental and using that to determine the most appropriate fit. In a recent priority list that was pulled, there were a number of new veterans identified in our community, and London Cares remains the lead organization in our community for veterans to be matched to. But having identified, across the homeless serving sector that veterans experiencing homelessness need to be prioritized, we had a whole host of other agencies come forth and say, you know what, we're going to make room. And so that allowed us to be more agile and tailor it, which veteran was matched to which program, of course, respecting client choice, and make a significant advancement in reducing the number of veterans experiencing homelessness. I just would lastly echo, and I realize we're getting close to time, some of the earlier comments around solving veterans homelessness sort of as a launching point. And I think that that's something London is starting to turn its attention to say, what from this can we learn? How can we bring in non-traditional community partners into the fold to help future priority populations? So I think right now it's how are we solving veterans homelessness one veteran at a time, and next I think the move is going to be to how are we solving homelessness one priority population at a time, and how can we use the lessons learned that
Well, it seems like we might have lost Zane there for a minute. But Zane, if you can still hear us, thank you so much for that insight. Oh, there, you're back. We lost you for a minute.
I hope I didn't cut out for too much of that, but I'll throw it back to you, Amanda. Thanks so much.
Thanks so much, Zane. And really exciting things underway in London, and can't wait to see what the next few months brings for you. As Zane alluded to, they identified, they were really close to functional zero in September, had only a few veterans left to house, and then identified early on in October, or towards the end of October, that there were new veterans entering the system that were being identified. And so being able to see that data allows them now to be responding and doing that matching that Zane alluded to, using resources and supports so that once veterans are identified, the move to housing is rapid and responsive. So thank you for that. One other thing I'll maybe just point out is that Zane alluded to London's participation in the Canadian Research Project. highlighting best practices around ending veterans homelessness. And certainly one of those pieces that came out was the importance of using a housing first model, a harm reduction model. And again, we can only end homelessness when individuals are placed into permanent housing and then providing the wraparound supports to keep them housed. That's not to say that veterans can't move. Of course, choice is important, as Zane alluded to as well. The other thing I'll just note is that we really leaned into London's standard way of asking the veteran question, and that really helped us to learn across the country and apply a universal standardization to that question. So thanks for that as well. You can access a range of resources that we have available on veterans homelessness at our website. That's the Built for Zero website there. The link is listed. This resource page continues to evolve and is updated on an ongoing basis as communities make progress. So stay tuned and feel free to access any of those resources or supports. Or if you have a recommendation for us on what to add to that website, feel free to send me an email. My contact information will be provided to you at the end of the slide deck here. And this presentation will also be made available on our website as well. So if you want to share this website out, or sorry, this webinar out with other folks that in your networks, feel free to do that. We are almost, we are just actually slightly over time. Marie, do we have any questions?
Hi, Amanda. Sorry, yes, we have nothing in the questions or the chat at the moment.
Okay, so I will give it maybe 30 seconds for folks to pop in a question. If there are no questions or you don't have time or want to ask the question on this webinar, you are welcome to contact me as well. The contact information is up there on the slide, my email address or my phone number.
So Amanda, one question did come in. Who is collecting the by name information?
So the lead community organization has oversight around data management for homelessness, and that's through a service agreement with the federal government. That lead organization submits monthly aggregated data to Built for Zero on data points, but we do not have access to individual client information. That's kept at the local level. Any other questions, Marie?
Oh, a couple are just coming in here.
Sure.
Yeah, so who would be the contact in Ottawa was the question.
So if you send me an email, I can connect you with the contact in Ottawa.
That looks like that's all our questions for right now, Amanda.
Okay. Well, thanks so much, everyone. Again, for those of you who are on the call, who served or are serving or have family members serving, thank you so much for your service to this country. And as Tim said, recognition and remembrance of veteran sacrifices is not a noun, it's an action. And we look forward to continuing to put that into action through our efforts in ending veterans homelessness. So thanks so much, everybody. Have a good day.